Hi, my name is Dyna Tucker, and I will be speaking today on the pathway to therapy from substance use. Getting into treatment with a substance use problem, there are many different options available. You can start with inpatient, right? So, for someone who is early in their recovery process and who is needing to detox from substances, who has made the decision to start on their journey to recovery, can go into inpatient. They can begin detox there. They can do a 28 or 30-day program, which would then hopefully, upon exiting, set them up with the right outpatient treatment providers, right? And that is what I am. I am an outpatient treatment provider. I am a licensed clinical therapist as well as a marriage and family therapist. And what I do is when someone comes out of inpatient, or if they're not at that point where they need inpatient but are on the pathway to recovery, they would come to me and we would begin therapy. So one of the main things that I start off with clients is talking about the underlying issues, right? When we think about substance use, oftentimes we're only thinking about the symptoms. We're thinking about getting the person to stop using whatever substance it is that they're using. And that is one of the most important things. While that is very, very important, oftentimes substances are a they are a coping mechanism for clients, right? So this is how they cope with whatever trauma that they have experienced in their life, whether it be trauma from their childhood, trauma from their adulthood. These are the things that they use to be able to escape these things that are bothering them, that they are trying to just cope with and live with on a day-to-day basis. So what I do is I talk about what are those things, right? We try to resolve those underlying issues in addition to then providing them with new coping mechanisms. So we cannot take away the substance, which is oftentimes the patient's primary use of coping, and then not replace it with anything. So we then would talk about replacing them with new coping strategies to help that person deal with the things that have been bothering them, to deal with the triggers that they have, right? When they think about relapsing or reusing substances again, these coping mechanisms they can use in order to prevent that. So that is one of the most important things that we have to do in order to maintain recovery, right? In order to help a person stay on that pathway and stay on that journey, it's very important for them to learn those new coping mechanisms. Another part of being in therapy from substance use is also involving possibly the family, right? And that's because oftentimes, clients, their families might be a trigger for them. And so, where possible, you want to be able to repair those relationships, because that can then become a support system for the client. That can then become a support system and people that they can then lean on, and also validate the client in many cases from feelings that they may have had, and emotions that they have been holding against their family. So having them as part of the process when possible can be very, very integral and very important to a patient's recovery process. When it's not possible, we explore helping the client get um, support systems from their community, right? In the form of either AA or NA meetings, that where they can then form a community of other people who are also going through the same process that they are. Some who may be in the beginning of their journey, others who may be further along than they are, and so having that community of people who understand you from a different perspective, from firsthand experience, is also very important when they are, particularly when somebody is very early in their recovery process. So finding community organizations and community support systems, particularly if this is a person who does not have that family support, right? Particularly if having the option of bringing in the family in therapy is not there, right? That's not an option. Maybe the family is far away, or the people have passed. You want to really build up that support system that they have within the community. And it is very easy for clients to think, well, I don't have anybody. I don't have any support systems. I don't have anyone that I can lean on. And so oftentimes we have support systems, but we may not identify them as that. Or we may think that I'm burdening this person with my problems if I talk to them. So, it takes a little bit of prodding, but we're able to oftentimes at least identify 1 to 2 people that these clients can really depend on, that they can lean on in moments where they may be feeling particularly triggered and are at risk for relapse. It is very important to have those support systems, and one of the main things in being someone's support system is identifying their readiness, right? Oftentimes we think about therapy and we think about maybe forcing somebody into therapy because we feel like they need it because we're able to see it from the outside perspective. But if the person does not feel like they are ready for therapy, if they do not feel like they are ready for treatment, then they are not going to be able to sustain the effects of being in recovery, right? They're not going to be able to sustain it. And that's why oftentimes we see people who may relapse and then get back on the right track to recovery. They may relapse, and understanding that that is a part of the process, right? Relapse is a part of recovery, and explaining to clients that so that they don't get discouraged when they do relapse. And it's all about, okay, well, this happened. Let's not spend too much time here. Let's get back on. Let's talk about what caused you to relapse. Let's talk about what were the triggers so that we can be more prepared should they happen again, right? Because life is going to continue to happen. And so building up those coping mechanism and building up that resilience to all of the different things that life will throw at us is going to be very important to this person. And so as somebody who is in their corner, in their support system, it's very important for you to assess their readiness, right? And it may feel like, you want to give up on this person. You want to just kind of leave them alone because it seems like they're throwing their life away. But it's so important for you to stay there, be there for them in whatever capacity that you can be there for them, so that when they are ready and they are ready to take that step and get into treatment, that you can be there for them and support them in the beginning of their journey. Right. So making sure that somebody is ready for recovery, making sure that they're ready for treatment is extremely important, because when we talk about treatment, when we talk about the recovery process, this is a lifelong journey. Right. And so in order to maintain that, a person has to be ready for the work that is needed to be able to get to the point of being in recovery for years and years on end, right? And understanding that just because you relapse doesn't mean that you have to stay in that place, right? That we're going to, you relapse and then you get right back into recovery. We talk about the things that led you to do that, and then we address them so that it doesn't happen again. Right. And so these are all of the very important things, is identifying what level of treatment you need, whether you need inpatient or outpatient, identifying the therapist that is the best fit for you, right? So sometimes you can go through your insurance. If you have private insurance or Medicaid, you can definitely find a provider through those means. Or if you have the means to pay out of pocket private pay, you can find a provider through that. And finding the right provider for you, the provider that you're going to be able to be honest with, that you're going to be able to be transparent with. Talking about substance use issues and the traumas that lie beneath that is very sensitive work. And so it is very important that you feel very comfortable with your therapist, that you can be able to share these things with them and not feel like you're going to therapy but you have to hold back, right? Because then it's not going to work. So finding the right provider and then putting the systems in place to maintain that recovery pathway, right? So after you find the right provider for you, identifying those support systems, both family, friends, and community, and then understanding that the journey that lies ahead is a continuous journey. Like there isn't really an ending to it. This is something that this is a pathway, it's a lifestyle change that you're going to be on for the foreseeable future. And this is something that, it's a way of changing your entire life. Right. And so in order for somebody to really be able to sustain these changes, they have to be there they have to be ready for that, and they also have to have the proper support system and proper resources to be able to maintain that recovery pathway. If you have any questions for me or would like to reach out to me, my email is dynatuckertherapy@gmail.com. You can also find me on my website at dynatuckertherapy.com. And I have a group practice, so you will be myself and other amazing clinicians that can help on this pathway to recovery. Thank you.